I actually had some pain in my chest that I didn't thought was maybe heartburn or something. Didn't think it was anything serious.
Sara Marthoski, a 49-year-old Medford, Oregon mom of 3 and grandma to a baby boy, went to the ER when she found out it was something very serious.
And she said, well, you have tumors all over your lungs and your liver, and we don't know where they're coming from. And I was like, oh, okay.
Follow-ups showed Sara had colon cancer that spread to other organs. Doctors removed the tumor from her colon. She then started chemo to attack the cancer in her lungs and liver.
That didn't sound like a very long life. And I tried to want to, see if there's something more I could do. So that's when I explored other options.
Specifically for her liver cancer.
I was doing research and I found that histotripsy.
Histotripsy, a new non-invasive procedure offered at Swedish First Hill in Seattle designed to target liver cancer.
She has metastatic colorectal cancer.
Dr. Evan Ong is a surgical oncologist at Swedish with a focus on upper GI cancers. He's also trained to perform histotripsy on patients. This video provided by Providence Swedish gives us a glimpse of how it works.
It's ultrasound driven right now in the sense that you visualize the space that you want to treat by ultrasound.
Sonic pulses create a so-called bubble cloud that targets specific areas to basically liquefy tumors.
By controlling the bubble cloud in a specific area, you can actually utilize that to map out and treat areas that you want to destroy.
The device is FDA approved to treat liver cancers, and Sara was an ideal candidate because she still has to be on chemo.
And so if you're on chemotherapy and you do surgery, sometimes we do it with an emergency, it's a known risk factor that you can have increased infections and complications during the surgery. Histotripsy is different because it's non-invasive. You really don't have to stop chemotherapy.
Sara traveled to Seattle to get the procedure in March.
I wouldn't have known anything was done, so I felt good the whole time, which was amazing.
She and her medical team are now awaiting scan results, and they're staying hopeful.
She has a fairly good prognosis in spite of the fact that she has metastatic disease that's changed over the last decade.
Sara says she is glad she found another treatment option for her liver and urges other patients to keep researching and not give up.
I've never asked for a timeline of what I have because I don't believe in that. It's all in God's will. So it'll be what it'll be, but we're marching forward and trying to find something to get rid of this.
For HealthLink, I'm Christine Pei.